Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Development of vagina. Upper two-thirds of the vagina develops from Mullerian duct, which is mesodermal in origin. Lower one-third of the vagina develops from urogenital sinus, which is endodermal in origin. Both these upper two-thirds and lower one-third of the vagina will fuse, and they form a septum. And this septum is formed. This septum has to undergo recanalization. If recanalization of the septum occurs, resulting in single vagina. Development.
thank you and thank you for watching.